collect them up, carry them to wherever your treatment area is going to be. You're going to be welcome to grab, and I didn't bring one in yet because I'll trip over it, one of the overbed tables to use as a treatment table and or a table to hold your stuff. You may want to choose to use two tables, one for your stuff and one for your treatment table if it's a forearm hand case. Okay? But you're going to be graded on whether you select the appropriate tools. So if you get in the middle of your presentation and you go, oh crap, I wish I had this or that or whatever, the table's right there. You can go grab it. You need to go grab it, and don't not do that skill because you didn't choose the right tool or you forgot to bring it with you. Go get it. But remember, part of what I'm looking at is, are you preparing appropriately for? Okay. So on your worksheet, when you start to create your worksheet, we'll just talk about that as we go. So you can create check boxes if you want to for washing hands. Wash hands in 2 check boxes. So when if you didn't do that twice, something's wrong. Check it off as you go. Okay. Select and prepare. So as you're reading your case, make a shopping list of the tools that you need to present your case. Okay. Obtains appropriate information from OT initial evaluation. Some of these things don't seem to make a whole lot of sense because we use the same form throughout the practicals, throughout the program. Okay. So while you're not going to get a full initial evaluation, what you're going to get is a scenario, and I've got one written on the board for when Barbara gets here. So you're going to have a scenario written out for you. That is considered your initial evaluation. Okay, so are you getting appropriate information? So do you read the case? You read what I'm asking you to do? Are you collecting? Part of did you get appropriate information is, did you select the right tools? Does that make sense? Part of it is, are you going to look at what I asked you to look at? Okay. And then the fourth thing in this section is leave treatment area ready for the next client. So once you're done, you're going to put your tools away, do any clean, put the furniture back where you found it, that kind of thing.
Are we sanitizing everything like a
No.
clinic?
No. Ideally in a clinic you would. We don't have time for that. Sanitize your hands, that's what I'm happy with. Okay. Preparation of client. So uses appropriate guarding and body mechanics in client positioning, transfers, and throughout the procedure. Okay, these are upper extremity cases, so you're not going to expect to do transfers. Okay, it's arms, it's not legs. Okay? But if it's arms, it's probably because somebody fell down and broke their arm, whatever, fell down and hurt themselves. So there could be some leg involvement, couldn't there? Even though I'm not asking you to look at it, there could be some leg involvement. And so what I urge you to get in the habit of doing is when you go, because we're going to have your patient in a waiting area. It'll be a waiting room, just like, if you were in a clinic. As you go to get them from the waiting area, don't lead them to your treatment area. Walk with them or follow them. So that, what? You can observe how they're walking. Okay, so it may not be, it may not be a lower extremity problem, but you may want to look at how they're carrying their arm. And is that appropriate to their stage of recovery? Okay? So think about that. So don't lead them into, and your patients will all the time say, show me the way. And I say, no, let me go with you. It's use every opportunity that you can to observe your patient.
So you can go next to them or be